So I've got Clark here, 2 weeks post ACL reconstruction, and he's having a little difficulty um, activating his quadriceps muscle. So what I'm going to do is put some biphasic pulsed current NMES on his quadricep to get it to activate. And the indications for that are just muscle weakness, extensor lag, having trouble activating muscles, things like that. Contraindications would be if he lacked sensation or if he possibly had a deep vein thrombosis in the area. So that'd be something that would make me reconsider doing this for sure. Okay, so Clark, so what I'm going to do with you today is electrical stimulation of your muscles so that we can help that quadriceps fire and get your leg straighter. So that what that entails is put some electrodes on your knees, and I'll gradually turn up the intensity until it makes your muscle fire for you. It might be slightly uncomfortable, but it'll help you get that activation so that you're able to get your knees straight and be able to walk better. Is that okay if we do that?
Yeah.
Okay, awesome. And are you comfortable in that position?
Yeah, this is good.
Okay. Let's see. Let me just inspect your skin really quick, make sure there's nothing wrong with it. And is it okay if I touch your knee just to test the sensation? You feel both of those?
Yep.
About up here. Good. Okay. So I don't see any contraindications, Clark, for NMES. What I'm going to do is place the electrodes. Let me get one on the Now for the parameters, so this is, like I said, biphasic pulsed current NMES. I'm going to use a pulse duration of about 200 microseconds, frequency of 50 pulses per second, and I'm going to turn up the intensity until I get a contraction of about 60% of a max voluntary contraction. Just since this is his first time, take it a little easy on him, but I may increase that to 70% down the road. And I'm going to have him do this for 1 hour a day, probably in 2 half-hour sessions, just so it's a little bit more comfortable. I could send him home with one to do at home, or I could just have him do 10 contractions at the clinic. Okay, and the purpose of this treatment is just to stimulate the motor nerves, so the duration and frequency are set to certain levels so that it can get up to the motor nerves on that curve. Okay, Clark, so I'm going to set this up now, and let's see, biphasic. We'll have 10 seconds on, 30 seconds off, so you should be getting stimulated for 10 seconds, and then you'll have a 30-second rest period, all right?
Okay.
Okay. Continuous frequency. Okay, so frequency is set at 50, width already at 200. Perfect. I'll have it on for 10 minutes, so I'm just going to start turning it up, and you let me know when you start to feel any tingling at all.
That's starting to tingle.
Okay, starting to tingle, so we're going to go up until it actually contracts that muscle for you. Okay, that's a pretty good contraction there. So we're going to start, and it should relax for a little bit, but then it'll start for 10 seconds, and I want you to push your the back of your knee into that pillow and get that knee as straight as you can, and hold that for the 10 seconds that it's stimulating you. Then when it stops, just relax, wait for the next one, all right? So if the patient became pretty efficient at just the quad set type of exercise, I may put a larger bolster under the knee and have him do a short arc quad, maybe even a long arc quad with the same type of stimulation, just to help get rid of that extensor lag. Okay, and I'll just check any irritation on the skin or anything.
No.
Feels all right. And how's the level? Do you feel like it's stimulating enough? Could you do some more, or is it
I feel like it's good.
Good. Okay. All right, and that was his second contraction, so that is all for this. And then I'll come back when the treatment is over, I would turn it off.
Set the post.
Remove these, just to inspect the skin again, where the pads are placed, just to make sure that everything went all right. Okay, is that all right, Clark? Did you
Yeah.
feel like that was an effective treatment?
Yeah, that was good.
Awesome.
Yep, that was great.